bumpy ride. Snacks and beverage service has been suspended. AC has given us some trouble. Sorry, folks. And Wi-Fi is out. And so is the entertainment. Yeah, I'm sorry about the smell, folks. We are aware.
I know.
Just one more quick note. We are going to have to deplane.
Come on!
We're like the plane ride that isn't a nightmare. CG Britgay. Good like that.
Since 1976.
Covering Grand Cayman, Little Cayman, Cayman right. One small step for man, one giant leap for mankind.
Radio Cayman in the Cayman Islands.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
In today's world, stress is a constant, and our bodies feel it. We live in a near-permanent state of fight or flight, where survival takes priority and healing has to take a back seat. But true recovery happens when we slow down. That's when digestion improves, inflammation lowers, and the body begins to repair on a cellular level. Because healing isn't just about doing more, it's about allowing stillness and deep rest. The Lightroom facilitates this. Make time to rest, time to heal. Your body knows what to do. Find us at thelightroom.ky or in Pasadora Place. We now offer full-body red light therapy as well.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
Hello and welcome to For the Health of It. I'll be talking with Dr. Gina D'Amato. She is from the University of Miami Health System, the Professor of Medicine, Clinical Lead Sarcoma, Medical Oncology. And then Miss Mari Wirks, who is the Executive Director for UHealth International. So, welcome to For the Health of It.
Thank you. Welcome. Thank you so much for having me. I'm excited to talk to you today.
Yes, thank you very much, Tara, for having us today.
I am so happy you're coming. We're going to be talking about sarcomas.
Yeah.
And the first thing I said, well, that's not like the best cancer to get. And Dr. D'Amato said, that's not necessarily true. So she injected some hope, and that's where we'll start. Well, first of all, what is sarcoma cancers?
Mm-hmm. So sarcomas are cancers that start out from connective tissue. So you have connective tissue throughout your body, bone, muscle, fat, cells that surround organs, cells that surround blood vessels. So if any of those cells turn into cancer, it's called a sarcoma. So it's a rare tumor, only 1% of all cancer, so it's very rare. In the U.S., I'm using U.S. population, we're 365 million in the U.S., and 300,000 Americans get diagnosed with breast cancer every year, 2 million with cancer, and 300,000 with breast, and only 17,000 with sarcoma. So it's rare, but rare doesn't necessarily mean bad. Right. Because it starts out from connective tissue, a lot of people heard of sarcoma, maybe they think it's only from the bone. But again, you have soft tissues which are throughout your body. It's kind of like the connective tissue is like the glue that keeps everything together. Okay.
It's like the fascia, right?
Yeah, it's like the fascia. And you have, even in your organs, you have connective tissue within the organs. You have your organ cells. So like a breast cell, for example, turns into breast cancer. Colon turns into colon cancer. But these could be the connective tissue that kind of keep the organs in place. So most sarcomas start out in the arms or the legs because that's where most of your connective tissue is, your bone, muscle, fat. But about 20% can start out in the abdomen, head and neck area, anywhere in the body.
So what should we know about them? I mean, they're connective.
Mm-hmm. Mm-hmm.
Okay, but like if one was to come in my arm, would I be able to see it, or is it something that's underneath the or in the connected tissue? Am I making sense?
Yes. So it depends on where the tumor begins from. So say it's in your leg or your arm. Initially you wouldn't feel anything, but eventually you may feel some swelling or a lump. Okay, and it won't be painful. So a lot of people think pain is bad. So if it's not painful, it's not bad. But over time, it could eventually become painful. So you want to be you don't need to necessarily be checking your body all the time, but if there's something abnormal that forms, it could be a sarcoma. If it's in the abdomen or it starts in the inside body, you may not notice it until it gets pretty big. You may be trying to work out and feel like you have a beer belly, or, I'm gaining weight because I'm menopausal, something like that. It's actually the tumor growing inside. So you want to be aware of your body. If it's the ones that start out in the legs, they can grow pretty big because you could be, starting in the thigh, for example, and if you're, and there's a lot of free space. Usually, if it starts out in the arms, they're a little bit smaller because your arms are smaller than your legs.
Yeah.
And if it starts out in the head and neck, you may see a lump before it gets too big.
So what's the difference between a sarcoma like that and a fat lump?
So that's a good question. So fat lumps you have lumps and bumps, and your body can form tumors, right? So the difference between a normal tumor and a cancer tumor is that under the microscope, the cells are very abnormal. In a cancer tumor or a malignant tumor, those cells have the ability to spread through your bloodstream, whereas a benign tumor like a lipoma, for example, or a fat lump, the cells they're not that abnormal, so they don't have the ability to spread through the bloodstream.
Right.
But about one of every lumps could be a sarcoma. So the majority of lumps are benign.
Right.
But one of them can be a sarcoma, so you have to be aware of the differences. So a regular fat tumor wouldn't grow quickly, okay, and it wouldn't become painful, and it would be more soft. Okay, if something is hard, if a sarcoma becomes hard, it will grow, and eventually it'll become painful. But if it's detected early enough, it may not. So that's kind of the difference. Also, a lipoma fat, you can move it around where you can kind of feel it and it will move around, whereas if it's a hard lump, sarcoma won't be movable.
Right. Okay. So other than what you just said about they're not movable, or I'm mixing it up.
A fat lump like a lipoma, if it's underneath your skin, you can kind of move it around. It'll move along with your skin. It'll be soft and kind of mushy.
Right.
If it's a sarcoma, it's going to be harder, and you doesn't really move that much with your skin.
Okay. Other than that, what are some other symptoms they need to do we need to look for?
Yeah, because sarcomas, like other, could start out anywhere in the body, which is different than breast cancer, for example, only starts out in the breast. Colon only starts out from the colon cells, whereas this can start out anywhere in your body. So you have to be looking for other signs. If it starts out in the inside, you may have fatigue. You may be anemic, meaning your blood counts may be off. You may be having low blood cells and a slow bleed. You can have some abdominal distension, meaning swelling, and you would have some swelling in the arms or legs. Those would be the main symptoms that you could look for.
Okay, and how are they normally diagnosed?
How they're normally diagnosed. There is often a delay in diagnosis because we really don't know. It's not very common. People don't know about it. They think a lump is probably just a benign thing. And then also in the medical schools, we're not really taught it because it's so rare. How would they know? You would go to the doctor. So is there often actually a delay in diagnosis? So a patient may take up to 6 months for them to actually go to the doctor, and then another 6 months for the doctor to even make the diagnosis. But the best way to diagnose it would be to get, if there's a lump and it's growing and it's hard, you want to get an MRI. If it's in the extremity, arms or legs, you want to get an MRI, and on the MRI it'll show findings. We can tell the difference between if it's benign or if it's suspicious for sarcoma. If it's suspicious for sarcoma, you want to get a biopsy, but it has to be done by an expert, because if it's not done by an expert, then it can cause problems. So if someone were to get an MRI that showed possible sarcoma, then their doctor could contact us. I don't know if there's a sarcoma expert here on the island, but we do have sarcoma experts at University of Miami, Sylvester, and we would have that doctor contact us, and we may be able to walk the patient. We may be able to talk through the biopsy, or we would have the patient come for the biopsy.
And I don't mean to cut you, but that's because if they inadvertently break it, it spreads the cancer, right?
So there's a lot of theories about biopsies, right? Like, if you get a biopsy, then it spreads, and what happens is that everyone with anything suspicious, you want to get a biopsy. That's how you get the diagnosis for any kind of cancer, okay? Mm-hmm. And yes, it is true that the biopsy could potentially, there are some cells that go on the needle, but eventually if you get diagnosed with cancer, the treatment will kill those cells. Whether the treatment's going to be with medication like chemotherapy or the treatment is surgery, it kills those cells. So we don't want to discourage people from getting the biopsy. We just don't want, sometimes a patient will go with a lump and they'll go to the doctor and they'll say, they won't think sarcoma, so they'll think, it's a hematoma, which is a blood cell collection, or it's an abscess, which is a collection of bacteria, or it's a pulled muscle, and they'll try to drain it, and then that's when it's really bad, when they try to drain it and they don't think of a cancer. If you have it organized where you can get the biopsy, we just have to know where the needle was so that when the surgeon goes and does the surgery, they know exactly where the needle was and then they remove it. Mm-hmm. But it's a coordinated effort.
So is that some of the reasons why it's so difficult to detect early?
Yeah. So, in other cancers, for example, we have screening tools because they're common, right? So breast cancer, for example, we have the mammogram. So we detect the cancer early. Colonoscopies, we both detect cancer early, but we also prevent it because it grows out of a polyp and we can remove that polyp, and then you actually prevent cancer from happening. But with sarcomas, we really don't have screening tools. We can't go around and do whole body MRIs on everybody, especially since it's rare. So that's why we want to build awareness around it. And really the message is know your body. If there's something going on with your body, you need to seek a doctor, and you need to tell them, look, there's something wrong. We're symmetrical, right?
Mm-hmm.
Our left side should look like our right side. If our left side doesn't look like our right side, something's going on,
Mm-hmm.
and we need to seek medical care.
Yeah, I mean, but you said it earlier, doctors aren't focused on that. So it's quite easy almost for them to dismiss you.
Mm-hmm.
So how do you say, look, all is not right in my body, and be, a staunch advocate for yourself, because a lot of that gets missed.
Yeah. I think what happens is that, I treat a rare cancer, so I'm always thinking rare. But, that's why I could never be just a general doctor. I would be sending everyone to get all kinds of tests. So it's a very delicate balance, right?
Yes, ma'am.
But I tell patients, and tell everybody, you need to know your body, and you need to talk to your doctor about it. Now, most problems that you have go away. Within about 2 weeks, 3 weeks, maybe even a month, it goes away. So you want to talk to your doctor about it, and then the doctor may say, well, come back to me if it still happens, which is fine. You can have the doctor say that, but then you have to come back to the doctor. What happens is a patient will go to the doctor. The doctor's like, it's probably fine. Come back if it gets worse. And then the patient thinks, well, the doctor said it was fine. So, and then their tumor will still grow. But then the doctor said, oh no, don't come, come back to me if it's worse. They think that means it's fine. But the doctor doesn't know to call you. You have to go back to that doctor. And doctors will listen if you've gone back several times.
Yeah, that's true.
That's the thing, is that you can't just go to one. I had a patient, for example, a young girl, 21 years old, and she had a swelling in her leg, and she went to the doctor, and they did an ultrasound. They thought it was a DVT, a blood clot. So they put her on blood thinners, and she was still having pain. But instead of going back to the same doctor, she went to a different doctor. She went to a different emergency room. And then she would keep going to different places. And then they thought that she was drug seeking because she was getting different pain medicines. They were like, you shouldn't have this pain for a blood clot. And instead, but if she would have gone back to the same person, they would have said, oh, wait a second. Let's look for a sarcoma. And then eventually, but year and a half later, she got the MRI, and, then it had already spread. So you have to go back to the same doctor.
Right. That makes sense. And when it spreads, it's not so good.
Yes and no. Yes and no. So, sarcomas are just like any other cancer. It's very different because it's rare, and sarcomas are different in that it affects children, young adults, and older adults, like lymphomas and leukemias, like the blood cancers. You don't see children getting breast cancer or prostate cancer or colon cancer. So it's different in that sense, and it usually affects younger people. Average age of cancer is 68, for example, where sarcoma's average age is 55. But it's still the same principle of any cancer. Cancers are either curable or treatable. So, for example, the cure rate in the United States for all cancers is about up to 70% because we detect it early. Sarcoma, the cure rate is about 58 because we're detecting it not so early, but it still can be curable. Okay, but if it's not curable, then it's still treatable. And that's what I tell patients. Look, even if it's spread, we can still treat you. We have lots of different treatments available. We have chemotherapy, which kills cells that are growing and dividing. We have molecularly targeted therapy, meaning that we try to figure out what genes and proteins are abnormal, and there's drugs to target those, so has less side effects and more specific. And then we have immunotherapy using your immune system. So we are keeping people alive a lot longer than we used to with these medications. So even if you can't be cured and it's spread, we can keep you alive, and we try to treat it like more of a chronic illness, right? More like high blood pressure. We don't cure high blood pressure. We just give you medicines to control the blood pressure so that it doesn't affect the function of your organs. Well, that's what we want to do. You can have cancer in your lungs and you not feel it. It's not until it affects more than half your lung, more than half, one full lung, that you may start needing oxygen. You can have cancer in 80% of your liver. Your liver still works. Once it gets to 81%, then the liver doesn't work. So we have medications to control it within the organs so that you can live with it.
Okay. So what is the difference, say, of treating a soft tissue sarcoma versus a bone sarcoma?
Okay. So bone sarcomas are more common in children, but adults can get it. And soft tissue sarcomas are more common in adults, but children can get it. Bone sarcomas are treated differently in that you have to remove the bone, but they can actually replace it. In the past, patients would get amputations, but now we have special surgeries where we can put a prosthetic implant in, and patients, we can save their limbs. Usually we don't, but usually requires chemotherapy because we believe it's because the bone, you have bone marrow, which makes your blood cells, that's inside the bone. So we think that it's so close to the bone marrow that it could spread easily, but it's very sensitive to chemotherapy, and actually the cure rates are higher for bone sarcomas. So we give chemotherapy and surgery for bone sarcomas. Okay. For soft tissue sarcomas, that can occur in other places, and soft tissue sarcomas we don't necessarily have to remove the bone, but they're more sensitive to radiation and a little bit less sensitive to chemotherapy. So not everybody with soft tissue sarcomas get chemotherapy, whereas bone sarcomas, everyone gets it. Now, with the exception that there are 170 different types of sarcomas, by the way. So there is one kind. So there is one kind of a bone sarcoma called a chondrosarcoma that starts out from cartilage. That one we don't give chemotherapy unless it's mesenchymal chondrosarcoma, which we don't have to worry about that. But and then soft tissue sarcoma, again, more occurs in adults, but still average age around 55, and we do chemotherapy, radiation, and surgery.
So what's the recovery and long-term follow-up care look like?
So the long-term care, once someone's been diagnosed and treated for their sarcoma, we need to follow them indefinitely. I call it patient attachment disorder. So I just I'm like, once you're with me, you're with me. And we usually get CAT scans or MRIs every 3 months for 2 years, then every 6 months for 2 years, and then yearly up to 10 years. After the 10-year point, depending on how high we think the chance of it coming back, at least we don't necessarily do scans, but we do physical exams and blood tests and every year. Now we're having some new technology that's still experimental, where we have what's called circulating tumor DNA, where we can potentially detect cancer cells in the blood sooner than we would see on a scan. And they have that for colon cancer. For sarcoma, it's still experimental, but we're doing testing there at Sylvester U Health. The company's been giving us free testing for our patients to see if we can validate, can we detect it earlier, and maybe they won't need as many scans.
Okay. So it's usually by a scan.
Yeah.
Okay.
We want to image, like say it was in the leg, we want to get MRIs of the leg, and then we want to look at every cancer has a certain area where we think it could spread. Sarcomas, if it's in the extremities, can spread to the lungs, so we want to look at their chest. Some types of sarcomas can go other places besides the lungs, so we want to look at chest. We want to look at the lungs, liver, abdomen, pelvis. So we get basically CT scans of the chest, abdomen, and pelvis. Now, sometimes we do change those, and we also see, because some of sarcomas, most causes are unknown, but some can be hereditary, where a gene was passed on from their parents, and if that's the case, they may be susceptible to other cancers. So we send everyone to the genetic counselor to see, do you have a gene that made you susceptible to this, and are you at risk of another cancer? And if so, they can go to what's called the genetic predisposition clinic, and they will get, depending on what gene is found, certain surveillance like whole body MRIs.
Can you have sarcoma of the brain?
So it's very rare that sarcomas start out in the brain. However, I do have, I've been treating sarcoma patients for over 20 years now, and I've seen there are some subtypes that can start out in the brain. One is solitary fibrous tumor, which is actually my research, one of my research focuses. That could be a primary brain, and then another called a Dicer 1, which is basically from a gene mutation. It is rare that sarcoma spreads to the brain. Mm-hmm. Certain cancers tend to spread to the brain, like lung cancer, breast cancer, thyroid cancer, kidney cancer. Very rare that it spreads to the brain. However, I have been seeing a little bit more cases of it spreading to the brain as of yet, and we're actually doing some research behind that, trying to figure out which kind, and should we be getting MRIs of the brain maybe once a year. Right now, it's not standard.
Okay. So I was asking what sort of
recovery.
Yeah.
Okay. Yes. So depends on the surgery and depends on what treatment. We like to have everybody get physical therapy because, say, if someone had a big surgery, they need physical therapy. That's very important. So we have a lot of services where we provide physical therapy, and then also if they had chemotherapy, they get wiped out, and then they might have not been exercising, although we do encourage exercise when patients are undergoing treatment. In the past, when people would be undergoing chemotherapy or any treatment, we'd say, no, don't do anything, rest. And now actually studies have shown that patients have better outcomes if they exercise during the treatment. So we try to encourage that. And actually, we have a study that we're doing we got a grant from the Florida Cancer Society that we're going to be studying sarcoma patients undergoing chemotherapy with exercise regimens and proving that they'll have better outcomes. So we want to encourage that mentally. People need to, the mind is very important. Okay, we have to fix the entire body, right? Mm-hmm. And when you have a cancer diagnosis, your brain can shut down. Okay, it's so much stress. You're dealing with all the potential treatments. You're worried. You have the C word. And so we really focus on the mental health. We have questionnaires that we ask people. I'm always, when a patient comes in, I'm like, tell me about your mood. And then we have psychiatrists, oncologists that deal specifically with that.
Is there anything else that you'd like to add before I throw it over to Mari? How to reach you?
Okay.
Would you tell our audience?
I would say there's a lot of hope for cancer treatment these days, and so you want to be talking to your doctor about any medical problems that you have, so that you can be treated for those early. Okay, know your body. That's the most important thing. You should not be feeling your body. If you feel your body, then there may be something wrong, okay? You don't want to be obviously paranoid and thinking, you have every disease, but be aware of your body. People know their body more than anybody else and speak up, and there is hope. You don't want to be in denial about things, okay? And cancer does not mean a death sentence. You can live with cancer. There's lots of treatment options available for you, so that's very important.
Thank you so much for that, Dr. D'Amato. So, Ms. Wirks, tell our audience how they can reach you all in University of Miami.
Okay, thank you. UHealth, the University of Miami Health System, has a full-service department, the UHealth International Department. That is a full-service department for international patients that are seeking care at the University of Miami. Dr. D'Amato represents a physician from Sylvester Comprehensive Cancer Center. You can reach our UHealth International Department at uhealthinternational.com or by calling 305-243 9100. So our department has a full service department where we provide care coordination and concierge services for patients. So we are there to assist and ready to help any Canadian that would like to come to us for services.
Okay, well, thank you so much for listening to For the Health of It. You've been listening to me interview Dr. D'Amato and Miss Marnie Wirks from the U Health. Thank you again for listening to For the Health of It. We are moving you to the life you want. Thank you so much.
Thank you.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
Are you feeling anxious, overthinking, or stressed, struggling with sleep and focus? Your physical health may be suffering too. Research shows that stress directly impacts your well-being, making it harder for your body to heal. At the Lightroom, we're here to help you find your balance. Our unique facility promotes the theta brain state, which is your body's natural way to achieve restorative rest and repair. Visit us at the Lightroom, Pasadora Place in Georgetown, and let us guide you back to wellness, rediscovering tranquility and harmony, because you deserve to feel your best. Call us on 938-HEAL or book online at www.thelightroom.ky.
When I first started going to healthcare pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square, where they care about my health.
This is For the Health of It with Tara Bush. Brought to you by the Health Services Authority. Caring people, quality service. Visit hsa.ky.
For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky. Also brought to you by Cayman Medical Center, Cayman's most awarded private medical clinic.
And U Health, International University of Miami.
World-class healthcare in the heart of Miami.
The Lightroom, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
This is the People's Radio Station. Radio Cayman.